and welcome. We're getting ready to do our sacroiliac joint Deuk plasma rhizotomy. Our patient has right sacroiliac joint dysfunction, also known as SI joint pain, and the treatment for this condition is often to fuse the SI joints. Now, fusion is good for surgeons because they make a good living doing fusions, but not good for patients. Patients need an alternative treatment that is less invasive than fusion and will provide them long-term relief. The problem with fusion as well is that it honestly doesn't really last and doesn't work in many patients. May have to make a separate incision. Let's see. Shot? How's he doing? Okay? Want me to wait? Yeah, just lay still. You're doing great. Everything's okay. I'll wait a minute. Let me have some num-num while we're waiting. What is that, lidocaine and marcaine?
Yes, sir.
Shot. So Davis and you will be doing a hip injection on the next patient. He's got right hip joint pain. We're doing a bilateral SI, but he wants his hip injected as well. Left, sorry.
So a hip DPR just to
Injection. Don't move, you're doing all right. I think it's still too low. Shot. 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 All right, so what I do is I feel the bone here. There's a lot of ligament, right? But you got to get down to the bone. So I go through the ligament. Shot. And you got to feel the bone, and then I just hop, literally hop and slides along the joint. Okay, shot. Make sure, obviously, you're not in the foramen, but the biggest issue is the ligaments. Still responding a little bit. So what we're doing, folks, is we're denervating the SI joint. We're basically cutting the pain nerves that are traveling from the spine to the SI joint, sacroiliac joint. By doing this, you get rid of the pain from the SI joint. Shot. And when I say shot, what I'm doing is I'm taking a picture with my X-ray machine. Okay, that gives me the ability to see the spine, the nerves, where the nerves are supposed to be. Now, we don't actually see the nerves themselves because nerves can't be seen on an X-ray machine. They can only be seen with your eyes or a microscope, endoscope, etc. All right. Yeah. Mm-hmm. Thank you. Shot. So I'm just going to go lateral to the foramen. And again, I'm feeling the bone with the tip of the probe. and I'm having to go through some of this ligament shot because the ligament obviously is pretty strong. But shot. Basically, I'm just doing this. That way you're burning at 5 millimeters and up to a centimeter off the bone. So if the nerve happens to not be on the bone there, you're actually able to get a column, right? And then I try to do this as much as possible. And it seems like, to me, at least, maybe you'll disagree, it seems like the joint is primarily innervated by the upper branches. What do you think? At least the painful part. So you want to come feel? Huh? Yeah. 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 Right? Up and down. Just don't come out of the skin, whatever you do. All right, so we're almost done. About another minute and we'll be done. But what we've done, folks, is we've basically burned and cut the pain nerves to the SI joint. And this is a heck of a lot better than a SI joint fusion. Right, Dr. Patel? I mean, we've done, at Deuk Spine, we've done the SI joint fusion. So you can actually feel the bone there. That's like S3 there, right? See what I mean?
I have never seen success with SI joint fusion.
Yeah, what Dr. Patel was saying is that we've seen a lot of patients who got SI joint fusions, not by us, but by other doctors, and we never see them happy. The SI joint fusions just don't work. But this procedure, we've had great relief and great results. So that's why we're promoting just the rhizotomy. And the thing about it is this is done by other doctors, but they don't do it the right way. They don't do it our way.
Sit it on, please. Thank you.
And we're done. So let's show the audience the incision. Let me have a marker. Okay? The incision, folks, is 4 millimeters. You see this, Henry?
Yes, we do.
Literally 4 millimeters. Okay? No blood. I mean, what, a couple of drops? And as opposed to a fusion. Now you can see his scar. Here's his scar from his fusion that he had done. I think either a laminectomy or fusion, right? Right there. Okay? That was from prior surgery. I didn't do it. But here's the incision. It's just tiny, and we're going to use a little Band-Aid. Now, the SI joint runs from here down to here. Okay? That's your SI joint. SI joint. Okay? And I made the incision here, but I used the skin. I pulled up north, and I was able to burn the nerve. So the nerves are coming here, 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 and here. And we were able to get all of them through one tiny little incision. All right. Any questions?
Just one question we have from Lanu on YouTube
Yes, Lonnie.
asking, just curious, do you do surgery on the back and neck on the same day?
Yeah, we can do certain procedures on the lower back and the neck on the same day. It's safe to do that. The only reason we wouldn't is safety, patient safety. We don't like taking risk here at Deuk Spine. We like our patients to do very well. So we take minimum risk, which means you don't want to be doing an aggressive cervical procedure and an aggressive lumbar procedure on the same day and the same time. Because if one area is not, if you're bleeding or hemorrhaging in one area, then I wouldn't know it because we're busy doing the other one. So there's a limit to what we can do. Any other questions?
That is it. No current questions.
We are done. This is a Deuk plasma rhizotomy for sacroiliac joint dysfunction or pain. And this patient's going to go home in 20 minutes. That's amazing. Avoid fusion. You don't need an SI joint fusion. Avoid RFAs. They don't work and don't last. This procedure works and it lasts. It's wonderful. Thank you for joining us.